Obesity is a growing issue in the even in the resource poor countries, low and low middle income countries, because people are not certain, they are not sure about the amount of calorie one should consume, and we are not actually taught in that way. Thereby, it's important to address the obesity. In fact, in the West, it is 30% plus. At times, it is 40% children, and your total population is obese. And in the developing nations like your ours, we have also obesity load. One study of this country in the city, it is 20% of the children are obese. In the village, it is 8%. So these obese people, obese children, they do have some of the health risk factors like diabetes, hypertension, dyslipidemia, and your joint issues, the your arthritis, and then obesity related other comorbidities, and there are complications like chronic renal failure, your liver failure, and plenty of other issues. And in obese child, they do die 10 years earlier than a normal counterpart. So the normal dietary use practice should be introduced into the family. Every visit, clinician should have talked about this part. It is the intelligence of the mother. At one stage, food deficiency was there, and people used to think they're eating today, that is forced, the food feeding, unnecessary calorie consumption, because of the food insecurity was practiced, and thereby this should be forbidden. Appropriate amount of calories, appropriate amount of plenty of fibers, vegetables, fruits should be taken. Your carbohydrate, your fat, salt, that should be avoided as much as possible, and their optimum growth, optimum calorie. Suppose the child after 6 months exclusive breast, there should be exclusive breastfeeding. Along with breast milk, he should take 1 to 2 complementary meal feed, which is compatible with his your culture. In our culture, it is rice-based food. You have your other carbohydrate foods along with it, the little bit of oil, little bit of sugar, and afterwards there should be little bit of your proteins and your vegetables plenty. Then the gruel, they are containing everything. Your small amount of fish meat also smashed, so that child can really swallow, can chew. So it's also essential. And then afterwards, in the adult, one should have 1800 to 2100 kilocalorie in the female and male respectively, and that should be free of almost any excess sugar, fat, salt, and the optimum weight, optimum linearity, height, they are essential while the child is growing. Afterwards, your 18 years to 21 years, the female and male respectively, they do not grow in height. If someone eats too much, what will happen? He will grow laterally obese. And obesity has hazards. As I said earlier, they have more cardiac illness, they have higher amount of heart failure, myocardial infarction, they have higher amount of stroke, they had higher amount of the bone diseases, your arthritis, and the higher amount of the all non-communicable diseases. They are very high over there, and ultimately these happy things are not happy endings. They are bad almost universally. So this is important. It is the talent, the intellectual of the parents, and then subsequently the child, and then the adolescents and the adult, to show what everything is in the internet. So, and in the different sort of published media, printed media. So learning this part and practicing this part is essential.